You don't like this?
No.
Well, this is October 2012, and we're here with Nancy. And actually, what is today? It's the
18th.
It's the 18th. Okay. Nancy's here with severe degeneration in her knees. Nancy, do you want to tell the viewer what's going on, how bad your knees are?
My knees I live with chronic pain, and some days are better and some days are worse. But for the most part, it keeps me very inactive, and I'm not used to that. And I have grandchildren I want to be able to spend my time with lots of energy, and I just can't do that anymore. So.
And I believe you were telling me that it hurts to walk?
It does. It hurts every step. The other day, my daughter, we were in the yard, she asked me to back up, and I had to think about it. What's the least painful way to do that?
Not good.
Not good at all.
And your exercise has gone way down.
It's like nothing.
And because of that, you put on some weight, you
Yes.
said, correct?
Yes.
Okay. And do you have any functional capacity with your knees at all?
Just getting from point A to B, in and out of the car, and I can't kneel very well.
And you have to think about it every step of the way.
Yes.
Is that correct?
With every move.
Okay. I'm going to reorient this. Okay. Could you please get out of that chair? Okay. You sit back down. Okay. Now go ahead up, and I'm going to ask you to step and walk out the door. Just go ahead out and walk out the door. Okay, come on back. Okay, was that very difficult?
Well, no, I'm used to it, but also I notice that it makes my feet feel unstable. With my steps are really unsure.
On a scale of 10, with 10 being unbearable pain, 0 being no pain, what do you give your overall?
I would say overall most days an 8.
An 8? Wow.
Yeah.
Okay. What I'm going to ask you to do is just consider your pain a 10 at this time.
Okay.
And that way, after we're done, we're going to see a percentage reduction. Does that sound all right?
That sounds fine.
Okay. I'll bend it. And when I say perpendicular, I'd like your knee right about there. Good. 90 degrees. And then bring your foot down as far as you can. Okay. And let's do the other side, please. Knee straight up. Flex your knee. Also, for the viewer, you can see that the knees are enlarged, with the left knee being larger than the right knee, consistent with the extent of the degeneration. Okay, we just got done with your first treatment, Nancy. Did it hurt?
No.
Wasn't...
It was, all I felt was pressure. A little sting with the shot as it went in, and then pressure.
Okay, so it was not an unpleasant experience?
No, it wasn't.
Okay. Can I see you get up now?
You mean? And can I put these down?
You sure can. And you can get up on this, which probably is safer. And then just walk right out the door, please. Okay, come on back. What do you have to say?
I feel lighter on my feet. Yeah, I can hear it sloshing around, but it feels better already, honestly.
Good.
Yeah, there's no pain. I'm sure the Novocaine has something to do with
That's
it.
correct. That's what I was going to ask you. Was there pain?
No.
There's no pain?
No.
Okay. Sir, take a look at her. Look at her walk and tell me what you think. Turn around and walk out again, Nancy. All right, come on back. May I video you too, Mr. Colgan?
Sure.
Okay. Have you seen her walk that good in recent times?
It's hard to tell this quickly, but I think she is a little more mobile,
Okay.
maybe a little more stable.
First of all, do I have your permission to post this on YouTube?
I'm fine with that.
Are you fine with it?
Sure.
Yeah.
Thank you. Okay. Doesn't mean I'm going to do it today. I want to see results over time. But your question was what to expect. Yes, there's a local anesthetic in there. And I would expect to see dramatic reduction of pain and sometimes complete reduction of pain. and you got complete reduction of pain. That's fine. But what then happens after the local anesthetic wears off? I use a very short-acting local anesthetic, like maybe 10-minute effect, 15-minute effect. Most of the people, the pain relief continues. Now, why would the pain relief continue hours, days, or indefinitely after the local anesthetic wears off? That's where this is how I explain it. The presence of oxygen in the joint is the key. The local anesthetic took away the pain right now, but the local anesthetic effect's going to be gone in 10, 20 minutes, 30 minutes at the most. But in a lot of people, if the pain comes back, it's only maybe 50%, maybe 40%, maybe 20%. And some people, they didn't get anything at all, but generally they get results. The presence of oxygen cuts down the inflammation immediately. There's inflammation in your joint. The degeneration, the cartilage cells are all starving for oxygen. And nutrients into the joint have to enter through the membrane called the synovium. It's the joint capsule. So it's an indirect delivery of oxygen to the cartilage. You with me so far? Mm-hmm. Blood cells don't deliver oxygen directly to the cartilage. They deliver it to the membrane of the joint, the capsule, and then oxygen has to diffuse across the joint fluid to get to the cartilage. I just put in oxygen. Those cells can get started cranking on repair processes immediately because it's oxygen that makes energy, and you need energy for repair processes. The ozone kicks in by stimulating cartilage repair. There are cytokines and other proteins that ozone seems to stimulate that helps with cartilage regrowth. And we've actually seen on X-ray improvements in cartilage, thickening of the joint space. So have I explained that to you with relative comprehension? Mm-hmm. That's what you can expect. Now, if you get good results with this and a lot of the pain stays away, I would simply do this again. If we don't get any results with one session when you come back, then I might consider putting in an additive. And there are additional things we can put into the local anesthetic. Sometimes we can put in high hyaluronic acid, which serves as a growth medium for cartilage cells. They use that to lay down new cartilage. There's other things that we can do, but usually I don't have to do that, and it can add to the cost as well. So hopefully this will provide you long-term relief. I'd like to see you back in about 2 weeks. Okay. Is that okay? Mm-hmm. Good. And thank you for giving me permission to video you.
Thank you.
What were you just saying, Nancy?
I said it feels really good right now.
Good.
Yeah.
I expected that.
Yeah.
Okay, let's see you get up and walk.
Well, getting up was easier. Yeah.
Okay, come on back.
Wow.
What did you say?
I said, wow.
Okay, please sit down.
Feels good to feel good.
Good, I'm glad. This is fairly typical. We'll know a lot better. In all honesty, you'll have a good idea in 30 minutes because the local anesthetic will be worn off. But in many cases, it just gets better and better because the oxygen is kicking in and it's quelling the inflammation.
I understand.
And it's inflammation that's causing your pain. Mm-hmm. And it's inflammation that's saying don't use your knee because you're continuing to damage the cartilage. For the viewer, you have severe thinning of your cartilage and virtual bone on the left knee in the medial compartment and near bone on bone in the medial compartment of the right knee. And fortunately, you're using orthotics, which is important because flat feet can tend to damage the medial compartment. And I've also told you we need to know about your dental history, which wasn't brought in today, right?
Right.
Okay, because that could play a role too.